All right. Good afternoon, everyone. Thank you, Ryan and Richard, for all that detail. I'll be brief in my remarks because I know that we are running a little bit behind. A couple themes that you'll find are finding that local story. I think all of us on this call potentially know somebody that has lost a loved one or know somebody personally in their lives that they were not given the best chance in a sudden cardiac arrest. So we want to use those local stories, find something small and start small, and it turns into something bigger. So we want you to take away some things today that you can do in your community, but then we also want you to think about how Project Adam can become a reality in your community as well. So who is Adam? And again, thinking about who your local story is. Adam was 17 in 1999. He was a bright kid, had no medical history whatsoever. When he was playing basketball at an away game, he suddenly collapsed. CPR was initiated and 911 was called. There was not an AED on site, and it's important to pause here because in 1999, public access AEDs were not widespread and were certainly not in schools. So at that point, at bullet number 3, Adam did not have a chance that day. EMS arrived and they happened to be right across the street from the gym. And so that's an important point to think. We can have the most beautiful EMS system, and we do have so many great EMS systems across the country, across the world, but if they can't get there in a couple minutes, we failed. So we need to have something in place. Adam passed away from sudden cardiac arrest. So the birth of Project Adam began in Milwaukee. Dr. Stuberger, who many of you know, began to work with the family and the hospital system to start to talk about how can we potentially put AEDs in schools and what does that look like. I think Ryan had alluded to the point that, you know, people kind of thought everyone was crazy for putting this type of equipment in schools, and why would we need it? The mission is really to empower the schools themselves to be prepared, not to do it for them, and a vision to eventually come to a place where we aren't hearing about sudden cardiac death in schools, and all children and adults have access to AEDs and the response that goes with it. Initial efforts, and I think a lot of us can speak to this in our own communities if we're a bit aware of if there are AEDs in place, or if teachers are being trained in CPR. Again, the initial efforts were to focus on the AED equipment and somehow helping the schools to come up with funding or ideas to get the equipment out there. Then evolved into more of a curriculum for school-based CPR and AED programs to make sure that they aren't just putting equipment on the wall, and there's a sustained practice program around the AED. Many of the points that Ryan and Richard came across. So creating heart-safe schools, I wanted to take a moment and talk a little bit about how that happens. And so really kind of the need. Does the school know about sudden cardiac arrest? If there's been a local experience with it, they likely will. But I think all of us know across our work that sudden cardiac arrest is still not a known topic to the general public. So there's a lot of education that goes behind that. If so, do they have a team to respond, or are they relying on one trained individual, such as a school nurse? And what happens if that school nurse is not in the building when something happens? So encouraging a full team that is doing a drill, is practicing the response. And this doesn't have to take a whole lot of time once it's in motion. Do they have that AED that's maintained? And in a real emergency, again, are they putting together that response so that they would know how to respond? Richard and Ryan both alluded to this, but a lot of our work really spans from and provided input to the statement in the nursing journal to really say cardiac emergency response plans are recommended for schools. It's the best practice. And so how do we go about helping schools and getting more boots on the ground to help them implement. So the evidence is there. It wasn't 21 years ago, but it is here today, and it's a resource that we can all use in our local communities. So specifically, we've based a lot of our materials off that cardiac emergency response plan and really compiled a lot of the materials that Project Adam have been working on for many years to create a Heart Safe School checklist. There's about 14 criteria on here, 15 criteria on here to hone into, is the school prepared for a cardiac emergency? And I think we all know that within our own communities, this may look a little bit different, and there may be certain areas of a Heart Safe School or the checklist that need to be prioritized. And I can speak from here in Wisconsin, a lot of our schools have the AED equipment, but we're really helping them package that into a program that they can embrace and sustain and carry forward. And that year to year, they're not wondering, is the AED, is the battery dead? Is it working? Do we have training? Do we have enough people trained? How do we do a drill? So the goal of a Heart Safe School is to really have that ongoing program. And once it's started, it really sustains itself and the school is prepared. So again, what people see, I think the glitzy, how do I get a banner? How do I get a certificate? And really what people don't see is there are some steps that the school has to work on, getting administrative buy-in, finding a school leader. There's a lot of pieces in the puzzle to put it together. Richard and Brian went into detail about some of the different, what are the components of a cardiac emergency response plan. Wanted to point out that on our website, we have a lot of templates that you all or schools that you are in touch with can customize different templates and videos for their use. So starting off with a template and then really making it what they need it to be for their response. So a national movement, how are we doing getting more boots on the ground across the country, and how are we going to move forward to make Project Adam and Heart Safe School efforts an equitable resource and available to anyone? I think you've seen this map already in the slides. We do have an additional site in Indiana, so we're up to 27 programs in 21 states. And so continuing to move the mark and get more sites that are invested, get more teams or get more people on the team that are willing to become experts in this area and help schools and communities. And again, from the beginning, it's starting with something small and making it into something bigger. So this is just a peek at our team. I know it's so fun to be on meetings like this and see how many attendees are here, and it's just, this conference is wonderfully put together. We had a Zoom conference last month, and so this is just a peek at some of our team members as we evolve into a new norm, hopefully not too much longer. But then Richard also pointed out some of the laws, and how do you find out which laws are pertinent to your state? You can click on this advocacy map and it will give you a highlight in your state of what type of CPR and AED laws are present. I'll brush over this because I know we're in the interest of time, but wanted to give you all, if there are individuals that are interested in helping to develop or culture a Project Adam affiliate site, what does that look like? And Project Adam really ties that together along with other community partners. I think all of us know nobody can do this alone, and responding to cardiac arrest and preparing for it is not something that's going away, and it takes a lot of partners to make it happen. So again, this can really tie it together. A medical director and a program coordinator work together. Usually it's a children's hospital, and we also work to sign agreements to make it official. The program or the trademark is housed at Children's Wisconsin, but we want this to be a nationwide program so that anybody can access it and be part of it. The team really helps one another. So there's really no one way to do it, but the end goal is making schools more prepared than they were and making sure that AEDs and CPR programs are part of the culture in your community. Here are a few examples of how the work is spread. And again, I think if we talk about starting small, it's talking to a school in your local community to see what they have in place, maybe assessing with the checklist, and any of our resources are free to anybody to use. And then trying to move the needle on, maybe they need an additional AED. Maybe they need to see a drill in action and try to practice one, but really starting small. But some of our sites host workshops, or obviously attend some conferences and speak about the work, link schools to different training resources so that they can become certified or they can purchase an additional AED. We utilize the strength and the energy of the patients in the clinics that we serve, many times part of heart centers, serve as those local advocates and referrals from the clinics. So again, I know we each kind of made this call out, but an invitation to join our team and connect with us. So if you do have an interest in this area, we'd love to hear from you. And this kind of shows a little bit about the growth. We've had a lot of growth in the last couple years, and this really does go along with kind of the concept that I think it's spreading by word of mouth as well, that we can come together and really help the schools in our area. This shows the number of saves that we've heard about from our collective group of affiliates, and that's 200. About half and half are going to be youth and adults. So it's an important note to make that the program is not just to protect children, but you're protecting adults as well. And then to date, over almost 4,000 schools across the country have become heart safe schools, about 500 in 2019, and just continuing to offer those implementation resources. And so I want to end it there. I know, again, we're short on time, but a huge shout out to the SADS and PACES leadership for inviting us to be part of this talk. And I will end it there.
Thank you so much, Alli.